You are watching 2+U Nevada. Very excited to be joined by Barbara Williams this afternoon, the co-founder of Tiny Toes Foundation. Barbara, thank you so much for being here this afternoon.
Thank you very much for having Tiny Toes on.
I am so excited to have you here and have people learn about this fairly new organization. First and foremost, tell people about the foundation. What do you do?
We started in 2022. Began program services in October of 2022, but we help families financially when a child is diagnosed with a complex medical condition, pediatric medical emergencies, not the things you would normally expect as a parent, not your appendicitis, not your RSV, your strep throat, but these are things that just blindside families, come out of left field, things that are so rare, and I can't even begin to tell you some of the diagnoses.
Well, you were telling me that you were a nurse, so your career, you've seen a bunch of stuff. And some of these patients that you guys are helping their families, you've never even
I've never heard of, I've never seen. But these are the things that really throw the family off trajectory. And like a lot of these kids are transferred out of the area, above and beyond Renown, our wonderful children's hospital here. But a lot of these kiddos need even further specialty hospitals and are sent to Salt Lake, Las Vegas, the Bay Area, and face months, if not a year, in the hospital. And so we step in and try and help with emergent financial assistance. We help pay mortgage, rent, lights. Let's keep the roof over their head, keep their lights on. We don't provide money directly to families. They send us their invoices, and we help them pay their bills directly for them.
And that's a great model too, because you know exactly where that funding is going.
Correct.
And it is going directly towards keeping a roof over their heads, the lights on. Since October of 2022, when you fully received your 501c3 status, how many families have you helped?
As of yesterday, we just helped our 99th family, and we have 8 more families in the queue. They've been referred, they're eligible. We've contacted them. They know about our program, and we're just waiting for them to get their invoices to us for payment.
And what I love about this too is with this model, you've got such an in with the medical community that you are getting the referrals. So these families aren't even actively seeking you out.
Right.
You're just picking up the phone and saying, hey, we're here for you.
Correct. What's really unique, and it does set us apart, is we network with the children's hospitals, obviously here in Reno, Renown, but also the children's hospitals in Salt Lake City, Oakland, UC Davis, Stanford, Las Vegas, and we actively network with their case managers and their social workers. So when they get a child and they see, oh, you're from Northern Nevada, we have a foundation that could help you, and they fill out the referral, they send it right over to us, and sometimes we're contacting the family when they've only been into this crisis for a couple of days, and we explain who we are and then give them the opportunity. We have no other application process. The only thing we require is the attestation by the healthcare worker, a simple one-page form. If the child is 18 or under, has a medically complex diagnosis, is going to require extensive hospitalization, and is from the Northern Nevada or surrounding Northeastern California rural communities. And that's our only criteria. These families are under so much stress, they don't need to fill out a long application. We don't base anything on socioeconomic status. We don't base anything on citizenship, religion, nationalities. It's just that one-page criteria form with those 4 criteria, and then we can step in and help. So,
as a parent, I can't imagine what these parents feel as soon as they get this diagnosis. And then, like you said, imagine your child gets a diagnosis, and then you're flown, it could be overnight, to another location, another hospital, and oh, by the way, you're going to be living here for 8 to 10 to 12 or months beyond.
Exactly. And parents lose their ability to work. They have other children that they can't be there to care for. I mean, it just evolves. And, parents you have your network of friends and family, but that support is limited. State and federal aid is limited. It's really long application processes and very low income thresholds. There are other nonprofits out there that help, but some of them are limited. Some are disease specific, like the Cancer Foundation, and we work very closely with the Children Cancers Foundation. The Heart Foundation is heart only. There's other foundations that help with medical expenses that aren't covered, but not with living expenses. And then there's some that require more extensive application and are somewhat based, not entirely, but a little bit based on income, citizenship, and other factors.
So you have the opportunity for community members to do monthly donations to help you out, or if they want to do a one-time donation. Either way, if somebody just wants to help Tiny Toes Foundation, where do they go?
They go to our website, which is tinytoesfoundation.org. Pretty easy, tinytoesfoundation.org. Click the Donate Now page, and we appreciate every dollar. $10 dollar per toe is a wonderful thing, and we can all afford $10 a month. And these families, like I said, they are in crisis, and we've already helped all these families, like I said, with the 99 plus 8 pending. But right now, it's the families that are going to come to us next year, and they don't even know. And that's what almost breaks my heart is, it's the parents that are expecting a baby. It's the parents with a toddler, a school-age child, a teenage child. That's 35 plus families next year are going to have their lives disrupted when they're told there's something wrong, and it's not good. It's not just the babies we take care of. It's 10-month-old, 3-year-old, 9-year-olds, 15-year-olds that were healthy, and now they're not. And these are really serious illnesses. The statistics are staggering.
Barbara, thank you.
Thank you. Thank you.
You're watching 2+U Nevada.
Thank you very much.